this is Brittany Resch. I am going to be performing the skill of drawing blood from a central line. So I'm going to go ahead and check my order. It looks like Ron Smith is due to have his blood drawn this afternoon. So we're going to go ahead and do that. So what I'm going to do, I'm going to wash my hands. Hi Ron, my name is Brittany. I'm going to be your nurse this afternoon. So it looks like we have to draw some labs off of your PICC line, so we don't have to poke you or anything. Do you have any questions? He says no. Are you going to be able to sit still while I draw the blood off of your central line? And he says yes. Okay, so I'm going to provide for privacy. I'm going to go ahead and wash my hands. Ron, are you able to tell me your name and your date of birth, please? And he does. Ron Smith, 2/1955. And that matches. Alright, perfect. I'm gonna just go ahead and put some gloves on. So if Ron had an IV running, we would stop the IV for at least 2 minutes prior to drawing blood. If he had TPN going, we would avoid that line at all, if at all possible. And then if he was on any life-saving medications, those could continue if that was necessary. So I'm just going to make sure that his line is at least a 4 French, and it looks like he has a 5 French. I'm using the most proximal line and with the white cap. So let me see here. Okay, Ron. I'm just gonna swap off this cap here. If the facility used an alcohol impregnated cap, we would remove that. But we don't have that, so we are just using an alcohol swab, swabbing for 15 to 30 seconds or per facility protocol. I'm just removing the saline here. Just gonna make sure all the air is out. Alright. Unclamp. I'm just going to do a regular flush here. Let me know if you have any pain or discomfort, Ron, okay? Okay, flush is done. Now I'm going to withdraw 10 mLs of wasted blood. Okay, I'm going to go ahead and clamp. I'm going to throw this in the waste of the shirts. Go ahead and get another alcohol pad. Swab for per facility protocol. We'll say it's been 15 to 30 seconds. I'm going to go ahead and put that cap right side up. Connect. And we are going to withdraw 5 mLs. We only need one little syringe of blood. So we don't need that much. Okay, so we have 5 mLs. I'm going to clamp. Disconnect. And put the cap back on. Swab for 15 to 30 seconds. going to do a pulse flush. Clamp. Have another alcohol swab. Swab 15 to 30 seconds or per agency protocol. Okay. We're going to do the second pulse flush through the IV or the PICC line. Unclamp. And we'll do a reclamp here. Okay. Take my blood here, and I'm gonna remove the cap, put it on the vacutainer, and I'm gonna put my blood inside the tube, and it'll fill up and stop when it's done. Okay. Out, put this in the sharps, and I'm going to label my blood right away, making sure to leave room in the back here so lab can see it. And I am going to verify that this is indeed Mr. Ron Smith, 2/1955, and it is. Okay. I'm going to take my gloves off and fill out any paperwork needed to send this blood down to the lab. I'm going to go ahead and wash my hands. And so if this was a pediatric patient or maybe somebody that wouldn't be able to follow instructions, you could have somebody else come in here and help distract them, comfort them, or possibly hold the arm while the blood is being drawn. I'm going to throw away all of my supplies. I'm going to make sure that Mr. Smith is in a safe position and that he's comfortable. Give him his call light, lower the bed, and then just let him know that if he needs anything, he can ring. And I'm going to document the date, the time, and the procedure that was done, so the blood that was drawn and sent to lab. So I think that concludes this skills video.